Joanne came to the clinic to see Dr. Priya. She'd been experiencing pain in a very private place.
It's something that you can't talk about. You can't sort of go to your colleagues at work and say, oh, this area really hurts today. You know, you can go in and say, oh, I've got a terrible headache, or this part of me hurts. But with this, it's a very personal thing.
Hi Joanne, what's brought you in to see me today?
Well, I've been suffering for the last couple of years with sort of pain and discomfort in my vulval area. It's sort of a sensation of burning, swelling.
And would this affect your sexual relationship with your partner?
Yeah, it made it very difficult. It does affect our relationship.
So what we'll do, we'll have a look first. So if you'd like to bring your heels together. Okay, that's it, and just flop your legs. So I'm just looking at the end of your cervix. So Joanne, I've just finished examining you. It appears to me that you have something called vulvodynia. Vulvodynia is basically unexplained pain in the area of the vulva. So there are certain factors which may contribute to the pain. They may be a bacterial infection, a yeast infection, chemical irritation, neurological symptoms, and what we can do at this stage is refer you to a gynecologist who could have another look, and then we can make a certain diagnosis there for you.
Vulvodynia is the condition describing pain and discomfort in the vulva. It's estimated that 15% of women are suffering from it. That's as many as suffer from hay fever. But discomfort down below is such an embarrassment to the ladies that nearly 50% of those suffering do not seek treatment. Unfortunately, the causes of it are still unknown, which makes accurate diagnosis difficult. A few weeks after seeing Dr. Priya, Joanne met with gynaecologist Dr. Mandel, an expert in vulva pain, who took a closer look to see if he could give a definite diagnosis.
If it stings or hurts or becomes painful, let me know.
Dr. Mandel confirmed Dr. Priya's suspicion that Joanne's problem was caused by vulvodynia and suggests the following. Use a soap substitute to wash the area. Avoid tight-fitting clothes, and before intercourse apply some anaesthetic cream to ease the pain.
There's a trade-off here. By doing that, you might benefit from not having that degree of discomfort afterwards. But the trade-off is that potentially, because it is a local anesthetic, it is going to take some of your good experience from sex as well.
Later, will Joanne manage to find any relief for her problem? Earlier on, we met Joanne, whose chronic condition had been causing her extreme pain down below.
I've been suffering for the last couple of years with sort of pain and discomfort in my vulval area.
Dr. Priya sent her to a specialist who advised her to use a neutral soap and to apply anaesthetic cream before sex. In addition to this, over the past year, Joanne has been having regular sessions of acupuncture, which have been helping to manage her pain levels.
Okay, Jo, take a nice breath in. That's great. Well, I've been seeing Jo about 8 weeks now, and slowly, bit by bit, she's really responded very well to the treatment. Okay, and breathe in again, Jo. She starts coming back and reports that she's feeling better, and generally just feels like she's coping with life now. Okay, and breathe again.
I feel a bit more like the old me again now, because at one point I lost hope of getting better, and I've actually got my hope back now that there is a light at the end of the tunnel.
That's great.
I'm on the way to getting my happiness back and getting my life back.